Good afternoon and welcome to the sixth webinar in our series about Grazier Safety Series, presented in conjunction with OB Organic and Grazing BMP. My name is Grazier and I'm your facilitator for today. Thanks for joining us for today's session, which will be going through the sixth element of a health and safety wellbeing management system, maintaining and improving the health and wellbeing of workers. The first 5 webinars are now live on our website, and I will provide that address at the end of today's session. Please send any questions through at any time during the webinar and we'll endeavour to answer them at the end. Please also take a few minutes to complete the survey at the end of the webinar. It provides us with valuable feedback. Any problems with accessing this link, please let me know. An email address will be provided later. Your presenter today is Alison Abbott, the Senior Advisor with the Healthy Workers Initiative Unit of Workplace Health and Safety Queensland. The Healthy Workers Initiative Unit is comprised of advisors who have a background in health, giving them the experience to provide support to businesses to help them create safe and productive workplaces. They focus on health and wellbeing initiatives that will maintain or improve the health of workers. With the Healthy Worker Initiative Unit working within the regulatory framework of Workplace Health and Safety Queensland, it is in a unique position to reduce injury and improve return to work outcomes by adopting a preventative risk management approach to addressing chronic disease factors in the workplace. Alison will talk about chronic disease risk factors shortly. I'll now hand you over to Alison.
Thank you, Roz. Welcome everyone to this session. This webinar will build on the previous webinars, which took you through a safety management system for health and safety. And as Roz said, today's webinar topic is about broadening the health in health and safety and taking a more holistic approach to workers' health. We will look at why we need to acknowledge worker health as part of a good business system and what you can do in the workplace to maintain and improve the health of yourself and workers and ultimately strengthen your bottom line and productivity. The same risk management approach to addressing safety can be used, and from the diagram on the slide you will see that by broadening the health and safety to include the well-being of workers into your existing policies and procedures, focusing on the workplace environment and having a positive workplace culture, and including the health of workers as part of your core business, we have found that businesses can increase their productivity through less sick days and a reduction in workers' compensation claims. Ensuring workers increase their knowledge and skills of healthy lifestyle choices is important, but you can see that if you just focus on education alone, your reach is limited to those who are interested. But if you create a healthy workplace by ensuring workplace policies and the physical and cultural environment supports good health, then all workers will benefit. If you create a healthy workplace this way, you will find that the culture will change so it becomes a normal and is just the way you do things at your workplace. This approach is much more effective and sustainable over the long term. And we know that caring about the health of workers increases their morale and engagement, which creates more motivated and productive workers. So today I will take you through an evidence-based 5-step framework that has been tried and tested with farms. The 5 steps are described in the resource you see on the screen, the Live Well, Farm Well Planning Guide. This planning guide with accompanying tools and templates was developed in consultation with horticulture farmers, but this resource is suitable for all farms and small businesses. The main point to make here is that if each of the 5 steps are undertaken as part of the overall planning, delivering and evaluating a health and wellbeing program in your business, then your program will be more comprehensive and outcomes are more likely to be positive and sustainable. So, similar to the series about farm safety management systems, we need to ensure we have management commitment. Management have a duty of care to ensure the health and safety of workers, and workers have the responsibility of being active in their own health and safety as well as their co-workers. Support and endorsement from management is critical for the implementation and success of any health initiative. You'll find that managers who provide resources, whether it's time or money, and who walk the talk in relation to good, healthy behaviours and are willing to consult and communicate with workers, demonstrate their commitment to creating a healthy workplace for their workers. As with consultation and coordination in safety management systems, the same strategy applies when addressing the health and well-being of workers. They need to know what you need or want to change, what the main health priorities of your workforce are, but also what's already working well. And workers are in a unique position to provide ideas and feedback on this. Assessing the health risks of workers and how the workplace environment is impacting on their health, whether positively or negatively, is an important step in the process. The information collected from this activity will inform your priorities and help you decide the type of activities and interventions that you can deliver that are reasonable and achievable. And taking action to control the identified risks doesn't need to be costly, but does need some dedicated time and effort. However, if you have a few interested workers or champions to promote what you are doing, they can become part of the committee or working group dedicated to health, safety and well-being in the workplace. Reviewing or evaluating your activities is often an element that's not done well in workplaces, yet is one of the most important steps. How do you know if your efforts in environmental changes have been effective? It's important to find out what has worked well and what didn't work so well, and so improvements can be made. It's also a good way to get recognition from management if you can show that what you are doing is making a difference to people's lives and increasing workforce morale and productivity. I will show you the tools and templates hyperlinked to this resource and provide some examples of how farms have used these tools to create healthy workplaces. And as I said, you don't have to do this alone. We have advisors that can help you along the way. But firstly, why has Workplace Health and Safety Queensland got a focus on improving the health and well-being of workers? This slide gives a snapshot of the health of the Queensland population with statistics taken from the latest Chief Health Officer report. And the key points from this report are that we are living longer, but the quality of life and health of people with some chronic conditions isn't optimal. We have an ageing workforce and this will grow. 47% of agricultural workers are over 55 years of age. And the incidence of chronic disease and musculoskeletal injuries are higher in this group, and the time it takes to return to work is often longer. In relation to alcohol and drugs, we have seen a decline in smoking rates in urban areas, but in the more regional, rural and remote areas, smoking rates are still high. And research is showing us that those working in the farming industry are more likely to drink at risky levels. After an increase in obesity levels over the last 6 years, the rates are now plateauing, which is a good thing. However, we have a high prevalence of overweight and obesity in rural and remote areas of Queensland. 2/3 of the Queensland population are overweight or obese, and 60% of obese individuals are in the workforce still. Obesity is linked to heart disease, type 2 diabetes, and some cancers, and these are the chronic diseases we are addressing. Our aim is to reduce the rates of these and the number of hospitalizations and illnesses associated with these diseases. So, if we can improve the main lifestyle risk factors that contribute to chronic illnesses, which are smoking, poor nutrition, risky alcohol consumption, and lack of enough physical activity for health benefits, we can make workers and the overall population healthier and more productive. The Queensland Council advised us that we could cut the rates of some cancers by 1/3 if we can reduce these risk factors. And in relation to nutrition and healthy diets, which is one of the risk factors, only 1 in 2 Queenslanders eat the recommended 2 servings of fruit each day, and only 1 in 10 eat the recommended 5 servings of vegetables. So you can see here that there is room for improvement. Poor lifestyle choices not only affect the individuals, but also has impacts on their families, work colleagues, and the community at large. And in relation to mental health and well-being, anxiety and depressive disorders make up 2 of the largest specific causes of disability. So if you think about it as having 10 employees, 2 of those may suffer from a mental health disorder at some stage in their lifetime, and that will affect not only their home life, but how they cope at work. And research is showing that males living in rural and remote areas are less likely to seek assistance for physical and mental conditions, and this is partly due to the lower access and usage of services than those living in urban settings. But chronic stress and limited social interaction can also increase the risk of psychological distress. So what are the risk factors for workers in the agricultural industry? Well, this slide has national data that compares the health of workers in agricultural industries to the national population. Agricultural workers have similar health risk factors as other industries in the overall Queensland population, showing that smoking rates are dropping, but in relation to good nutrition, physical activity levels, unhealthy weight levels, and risky alcohol consumption, they are above the national average. And research is also showing that male farmers and farm managers experience higher death rates from coronary artery disease and certain cancers, respiratory diseases such as chronic asthma and bronchial infections, stress, depression, and some other mental health issues. And often in the small farming industries, when the owner is not well, the business can suffer. So we are advocating for looking after yourself and your workers the way you look after your crops and your livestock. So how does the health of an individual impact on business and at the workplace? You can see the statistic in the top left-hand box in the slide that shows smokers have an increased rate of injury due to poorer circulation and decreased oxygen delivery to the muscles. They also have an increased risk of heart and circulatory diseases and lung cancer. And in the top right and bottom left diagonal boxes, you see that workers who are not in a healthy weight range are more at risk of sustaining an injury and take longer to recover. We need to acknowledge here that there are personal factors and work-related factors that contribute to an individual's overall health and well-being. Take, for example, a person who may be overweight or obese, possibly because of their genetics, their level of education or income levels, and some of these factors we can't control in the workplace, apart from increasing their knowledge and skills, but these personal factors can impact on the health and safety behaviours of the worker. If we concentrate on creating a healthy workplace, however, where we acknowledge and address the workplace factors that contribute to the health and safety of workers, such as long working hours, work demands, ensuring workers have access to healthy foods and proper meal breaks, opportunities to be active if they have sedentary occupations, and changing the culture from eating nutritionally poor food to eating more healthy choices, then we can start to positively influence safety and well-being behaviours and ultimately business outcomes. So now we will go through the Live Well, Farm Well planning guide tools and templates. As previously mentioned, gaining management commitment is essential. By conducting the Healthy Farm scan shown in the slide at your workplace, you can get a picture of the characteristics of your work site that is either supporting or not supporting the health of workers, and this can create the rationale of why you would want to address the health and well-being of workers. It asks questions on the type of physical infrastructure that is in your workplace that supports worker health, including your business systems and procedures, so you can then build on what you already have, and it also gives you ideas on the types of strategies that can be incorporated into your workplace and management systems. If you have a number of work sites where workers are based, it's a good idea to have someone at each work site undertake this scan. And when it comes to reviewing the actions you've taken, this tool can be used as your baseline information. And 1 to 2 years down the track, it can be conducted again, and you would see what changes you have been made. This small but effective exercise can assist your planning and give momentum for further action that could either be low cost or no cost to the business. Planning, consultation and coordination go hand in hand. An integrated workplace health, safety and well-being program that has a number of interested people involved in the planning, delivery and monitoring of strategies are more successful over the long term. As with the delivery of any program or system, it's more successfully carried out if there's a person responsible for leading or overseeing the key tasks. Communication with workers and getting ownership and input from them will create more interest in what you are trying to achieve. This step is about who you need to drive and support the program and how you will communicate with workers. If your farm has itinerant workers or backpackers, some of these workers may have expertise, say in nutrition, be personal trainers or health professionals who could provide education and guidance to your program. The top 2 pictures in the slide are set in a workplace where management accessed 2 of their backpacker workers with expertise in nutrition and physical activity. The nutritionist provided a healthy eating education seminar, and the personal trainer had workers undertake a physical activity workout. Sorry. A number of farms in North Queensland accessed their local health service providers to undertake a health needs assessment with workers, which showed each worker their chronic disease health risks in relation to their weight, their diet, their levels of physical activity, and smoking and drinking habits. This activity can be a good way to start the healthy workforce conversation, as workers will be more aware of their risks and the type of actions they could take to improve their health. So you can see that by implementing activities doesn't need to be expensive. The main resource you may need to supply is worker time. Step 3 is undertaking a needs assessment and is one of the most important steps in this framework. It not only raises awareness amongst workers on their positive or negative health behaviours and can encourage them to think differently and change their behaviour, but the process can contribute to an improved health culture and outcomes over the long term. It also gives management the opportunity to take a step back and consider the noticeable health issues at the farm and their priorities. If you have a culture of open and transparent communication or just starting out on the journey of addressing worker health, the discussion tool for small groups is one way of starting the conversation. This tool, shown in the slide, asks workers what area of their health they would like to improve and gives you an indication of their commitment to supporting health and wellbeing activities. If your workers are literate in English and would prefer more privacy, this tool could be used in a written questionnaire format. If you have a range of permanent, itinerant and seasonal staff or a variety in ages, you may need to consider if the health issues are the same for each group or some groups have different needs and interests, and what management want to get out of the program should also be considered. Alternatively, if you're a larger farm business and workers have access to computers or iPads, then the online Healthier, Happier Workplaces, Healthy People survey could be completed by each worker. They would need to be literate in English to use this tool or get some assistance to complete it. The benefits of using the Healthy People survey is that it provides an aggregated report that gives you a picture of the health of your staff and highlights the main chronic disease risk factors that could be addressed. And the link for the survey tool is displayed on the slide. Or you can develop your own survey or have a brainstorm at lunchtime. These times are good for two-way conversations between management and workers. A large pastoral company in Queensland developed their own health and wellbeing survey, which was completed by staff at all their properties. The information was analysed and key health risks presented to management, along with some suggested strategies to address the priorities of smoking and nutrition. They implemented the free Quitline Workplace Quit Smoking program, which has still been offered to workers, and encouraged healthy choices through the ample supply of fresh fruit and vegetables. The company organised events where a large portion of their workers could come together and also participate in voluntary mental health and wellbeing checks, which were run by the Royal Flying Doctors Service and local health clinics. Workers were provided with health education and referred to medical professionals where health conditions requiring follow-up were identified. At these events, the key messages about healthy nutritional choices, quit smoking programs and sun safety were reinforced with written and verbal information and healthy food choices being provided at the events. The Health and Wellbeing program has been supported by management for the last 3 years and health and wellbeing activities provided throughout the years. More recently, the company placed a higher focus on mental health and wellbeing and conducted a survey to measure the mental health status within the workforce. They responded to the results of the survey by engaging with the Black Dog Institute to present information to managers on how to identify and deal with symptoms of mental disorders. The company is now planning to take a more holistic approach to address employee health and wellbeing into the future by rolling out programs that address the key risk areas identified. And upper-level management support has been a key to drive the success of these programs. Step 4 is your action plan, which will outline all of the activities that you want to do over a period of time. It should outline what you are going to do, when you are going to do it, and who will be responsible for making it happen. Prioritising the most important issues relevant to your business and workers and considering the resources you have in hand can get you started. The action plan template on the slide is provided for you to use as part of the Live Well Farm Well Planning Guide. There are examples of activities that might work on your farm, or you can input your own particular activities. An important aspect to consider at this step is that if you provide education and healthy lifestyle behaviours to your workers, then the workplace is supporting that behaviour you want to change. For example, if you have an education session on healthy nutrition, you need to ensure that meals provided to workers are healthy, or the nutritious choices in the vending machine outweigh those that are not. And if you hold workplace events, then the majority of food provided is supporting the education they have been given. You may also want to ensure workers have the facilities to prepare food and store it until meal breaks, and have an area to eat which is smoke-free. Similarly, if you have alcohol and drug testing, then workers are provided with information on where they can get help if they experience a problem with alcohol or drugs. And if you have a policy around alcohol and drugs, then that is communicated to workers and what actions and/or support is expected from the business to help them. Step 5 is the ongoing process of monitoring and reviewing your program. It doesn't just happen at the end and is a very important part of the process. Checking to see if your time and effort that you invested in the health of workers is producing positive outcomes is critical for ongoing engagement and support from management. Your Healthy Farm scan and results of the initial needs assessment can form the baseline information, and by conducting these again 12 months to 2 years down the track, it will make it easier to compare changes in the health behaviours of workers and if you made any changes in the workplace environment that support them in choosing the healthy lifestyle choices. On the back of the action plan template within the resource, you will find some examples of evaluation questions you could use to measure activities. But of course, the questions you ask will be relevant to the actions you have taken. As this step can be quite daunting for some workplaces, the Healthy Workers Advisors can assist you with this step too. I'm now going to talk about the project which resulted in the development of the Live Well Farm Well resource, where 5 farms and a total of 710 workers in 15 different work sites took part. A voluntary needs assessment conducted by local health professionals was conducted, and the priorities of managers and workers identified before they spoke about an action plan. The main risk factors identified were smoking, unhealthy food and drinking choices in the vending machines, unhealthy weight amongst some workers, and lack of physical activity, particularly those in packing sheds. As you can see in the slide, the farms made sure they addressed issues in the physical and cultural environment, as well as increasing the health, knowledge and skills of workers. Over an 18-month period, there were some significant changes in the knowledge and behaviours of workers towards more healthy lifestyles. A whopping 66% reduced their risk of developing type 2 diabetes by being made aware of their risk factors, increased knowledge and awareness of what is healthy and what is not, reducing smoking, and being more active. Some of the farms integrated wellbeing into their health and safety policy, and others chose to have a separate health and wellbeing policy. An example of that policy is included in the Live Well Farm Well resource. What also contributed to the sustainability of the programme at these workplaces was the positive changes in managers' attitudes regarding their perceived role in the health and wellbeing of their staff. At the beginning of the project, less than a quarter perceived they had a role in addressing the health and wellbeing of workers. Post-evaluation, however, showed that 100% believed they could have a role and could see the benefits of doing so. So some farms removed their vending machines or liaised with the providers to increase the amount of healthy food and drink options. And farms also started to provide healthier food choices at gatherings and celebrations to support that consistent message with the education that was being delivered to the workers. By going through the 5-step process, 2 farms achieved Healthier, Happier Workplace Bronze recognition and were highly commended in the Queensland WorkSafe Awards in the Best Workplace Health and Wellbeing category. And this achievement can support them in promoting their workplace as an employer of choice. Another project with Turf Queensland Peak Body also had some good outcomes by engaging with managers and workers. Turf growers are largely made up of small and medium-sized businesses with not a lot of spare time on their hands, so it's essential that their health and wellbeing activities are integrated into their everyday processes and systems. They included information on healthy lifestyle behaviours through their toolbox talks or social events, and delivered educations relevant to their workers' needs, for example, financial budgeting advice, and using the local banks to deliver these. They also reviewed their policies, and if they didn't already have a no smoking policy, introduced one and offered quit smoking information to workers. Some safety strategies were integrated into the health and safety systems, and they supported the information they were providing on healthy eating by ensuring there were healthy food choices at morning teas and catered events. Again, you will see the pattern of ensuring environment and organisational systems are supporting the behaviour change of workers. Over a period of time, and with support from the Turf Queensland Peak Body, some farms saw an increase in the number of workers making changes, resulting in less smokers or reducing the amount of cigarettes they smoked each day. And in the top picture, you can see that they promoted taking time from sitting in machinery to doing some stretching exercises, with the resources they have in hand. The improvement in team morale with some workplaces has kept up the momentum of workers and managers being interested in supporting health and wellbeing activities in this industry. So, in summary, I hope you can envisage the opportunities at your farm for integrating the health and wellbeing of your staff into your current systems, whether it's safety, quality improvement, or if you are a larger business, your HR processes. The similar steps to managing a safety system applies. Without management acknowledgement, commitment, and leadership by walking the talk, your wellbeing program will not be sustainable or as effective. Activities or programs don't have to be costly, but they need time and effort, so management commitment to these resources is required. Consultation and coordination is key to understanding the needs of the business and workers before you can prioritise and plan for activities. And the need for continual communication and consultation is paramount to get feedback and ongoing engagement from all workers. Undertaking an audit will identify the resources you already have and what needs to be changed within your current workplace environment and systems. A strategy for finding out the health needs and interests of workers is essential to help you identify priorities and ensure any strategies you put in place are relevant and achievable. And monitoring and reviewing is usually the step that's not done well. However, if you have a process in place to evaluate how effective your actions have been, whether they are sustainable, what changes have occurred from your efforts, then the results of these questions certainly adds value for all workers, managers, supervisors, and co-workers. It can provide motivation for continuing the program or create discussion on what was good about the activities and changes made in the workplace and what could be improved. So, within the Live Well, Farm Well Planning Guide are the tools and templates we have gone through and all you need for planning, delivering and evaluating a health and wellbeing program at your workplace. The Health and Wellbeing Policy template can be developed on its own, or you can use some of the wording in your current policies and procedures. The Healthy Farm Scan, which is the audit tool to check what you already have in place to support healthy lifestyle behaviours at work and gives an idea of what could be implemented. The Healthy People discussion questions start the conversation and identify the health risks and interests of all workers, and an action plan template to plan your activities and how you will review them with examples of evaluation questions on the back. There are also 5 webinars which cover all the lifestyle chronic disease risk factors, for example smoking, poor nutrition, risky alcohol consumption, physical inactivity and mental health, and how to address them. And 2 videos from 2 banana farms who delivered a health and wellbeing program on their farms. The link to access these resources is via the GrowCom website, and the link is displayed at the bottom of this slide. There are a number of free or fee-for-service programs available to assist you, and of course the Healthy Workers Advisors can give you more information on these. There are 3 free programs under the Healthier, Happier Workplaces initiative, and that is the Workplace Quit Smoking program operated by the Queensland Health Quit Line, which is achieving good returns on investment in reducing the number of workers who smoke. The Get Healthy Information and Coaching Service, which focuses on increasing healthy eating practices and physical activity levels among individuals. And the 10,000 Steps Workplace website provides all the resources you would need, except pedometers, for workers to implement a physical activity challenge. Some of the non-government agencies also have workplace programs, so you can either look on their websites or give us a call for information on what they can offer. Thank you very much for joining me today. I hope it was informative and useful to you. I'll now hand you back to Roz.
Thanks very much, Alison. So please contact us to have a chat about your ideas anytime. There's plenty of free advice available via the phone or email, or if it's possible, they can do workplace consultations as well. So on the next slide, there are the contact details, and you'll see there's a dedicated email address for the healthy workers at justice.qld.gov.au, or give them a call on the number 1300 362 128. We have time for some questions now. And here's a question, Alison, for you. If we didn't have time to do all the 5 steps, which do you think is the most important to start with?
Thanks, Roz. Good question. because farms don't have a lot of time. But as with any program, the planning process is the most important. So that includes having your management commitment and why you would want to create a healthy workplace, but also endorsement for following the process and seeing it through to the end. So the risk assessment and the needs assessment step is also very important. Historically, workplaces would offer one-off ad hoc activities to engage workers in healthy lifestyle behaviours, such as a weight loss or physical activity challenge, and they can definitely get people engaged and thinking about their health. But unless you find out what your risks and needs are, as well as workers' interests, you may put programs in place that are not taken up and a waste of effort and time. So I would suggest conducting the Healthy Farm scan and some form of communicating with workers and managers to find out what their needs and interests are to decide on your priorities. Then this process starts a conversation which can lead to the engagement and ideas and people putting up their hand to be involved. So that would be my recommendations.
Thanks, Alison. And so another question here, what type of resources and services are available for farms in really remote areas?
Well, in relation to the information, if you want information for workers, if you have access to the internet, there are a number of government and non-government agencies that can provide brochures and posters. There are also a number of apps that people can download to assess their health and give ideas on healthy lifestyle behaviours and choices. And the Healthy Workers Unit has a resource sheet with contact details for some of these organisations, and we can send that out to everyone after the webinar. In relation to creating a healthy workplace, it's really about auditing the work environment. If you have an alcohol and drug policy, for example, do workers know about it? Do they have input into its review? Are you complying with the tobacco legislation? And ensure there's a designated smoking area, so passive smoking is not an issue where people are eating or socialising. Is there a policy about providing only a certain amount of alcohol at functions or social events or after work? So it's about auditing these sort of things. And what do you do in relation to injured workers? Can you give them meaningful work or ensure you're working with your insurer and medical services to put them on a pathway of recovery and better health? And do they have the say on this? So what systems do you already have in place? And another example might be, is the food provided meeting the dietary guidelines? Comfort food, which a lot of people want when they're socially isolated, can still be healthy depending on how it's cooked. And again, the Healthy Workers Unit can provide resources to assist with this, or Nutrition Australia are really good at assisting with developing a healthy food and drink policy that is relevant to your workforce. So some resources are scarce in remote areas, but country people are used to making the best of what they have. So having a conversation with management and workers on what their interests and needs are, I'm sure we'll come up with some really good solutions.
Thanks, Alison. I've just got another question here. What are some different ways that you can communicate or consult that are fun or different?
Well, it depends on your workplace, but within the agricultural setting, people get together. It's a good idea. I know in lunchtime meetings, toolbox talk meetings, your safety meetings, that's a good time to do it. You have to get your supervisors on board so they can communicate with workers on an ongoing basis, so they need to be involved at all stages of your program. You can have competitions where you can give some prizes for people to give some ideas. You can get, it's really consulting with your workers and getting some of their ideas as well. But social media, of course, for young people is a good way to communicate these days as well. Okay, thanks, Alison.
Yeah, it's always bringing up a challenge between different workplaces or people groups within a workplace is always one way of getting people going as well. So that brings us to the end of our presentation today. Thanks for joining us. The completed webinars will be on our website, www.worksafe.qld.gov.au, over the coming weeks, and they'll be up there with all the other webinars we've previously presented. Don't forget about taking a few minutes to complete the survey that pops up at the end. And other ways you can keep in touch with the information and keep in touch with us is to subscribe to the eSafe through our website. There are also 3 rural dedicated eSafes each year, and we highlight agricultural businesses who are promoting the health and wellbeing of their workers in these. We also promote health services and programs suitable for agricultural businesses. So if you'd like to contact us for more assistance or information, or if you have any questions specific for your workplace, please don't hesitate to send an email to the address shown at healthyworkers@justice.qld.gov.au or phone 1300 362 128 and ask for your query to be sent to the Healthy Worker Unit Initiative. So for any workplace health and safety queries, just a reminder that we also have a specific email address. It's agriculture@justice.qld.gov.au, and we'd be very happy to answer your individual questions and send out any resources that you might need. So we will send out the templates and information from today's session to everyone who registered in the next few days. Thanks everyone for attending today.